This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
What's that old saying? What you see is not what you're going to get. Well, we're talking about the weather. I mean, what you're seeing now is it's all right, but later on we're supposed to be nice, and tomorrow's supposed to be pushing 80. So listen, we'll take it, right?
John, it can't come soon enough
that's
for
right.
Dr. Molly.
Not officially spring yet, but we'll take it. Welcome to Health Watch. As always, we're here every Sunday, 8 till 9. Talk Radio 1210, WPHT. And as we always say, the clue is in the title of what the show is about, health, specifically you and your family, and how Dr. Molly Fantasia and her staff at Innovative Medical Associates can help you and your family improve your overall health picture. And we talk about a variety of things and a variety of issues. And as always, we welcome your participation here on the program at 855-839-1210, 855-839-1210. Again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And what you'll find at Innovative Medical, it is a truly unique situation, Dr. Molly. I mean,
you're very kind, John.
It's hard to even describe here on our hour show, but it's there and it's helpful.
It's hard. I think our overview probably does somewhat justice to what we do. So you know, and I know, we're a primary care facility. We can do everything any other primary care facility can do. So, for example, if you have a cold, you come in, we can treat the cold. If you have an infection, we can treat that. Viral infections, we can treat that. You know, our docs and providers can write prescriptions for anything you need, but that's not the focus of what we do. What we do, in addition to that, is to try to use the least amount of the pharmaceutical and augment it with a more natural substance, the kind of things you might find in a health food store.
And later on, we're going to talk about some specific patients.
Oh, yeah.
And you have often done this. You've explained how what you do has helped them improve
quality of
life, and it's happened, I mean, hundreds of times in your clinic.
It has. And I think our focus is truly on the functionality of the patient. In other words, we don't want you to just live in the world of illness. We want you to live in the world of wellness. And the way to do that is, yes, we have to treat specific challenges. Of course, you go into any primary care facility, you want to be treated, but the docs have the ability to treat you with the pharmaceutical, and then in addition to that, we have the resources to treat you with more natural approach, and therefore we can help get you through a particular challenge maybe a little more quickly, and also continue to keep your quality of life while you're going through it.
I had a client of mine this week, and his office is not far from yours, and I was going there, and he said, well, where are you going first? I said, well, I'm going to Dr. Molly in Marlton, and I'm getting a vitamin C treatment plus other things. He said, what's that? Does it help you? I said, well, I don't remember the last time I had a cold. And I said, I always feel pretty good, and I feel pretty healthy. And if I feel something coming on, it goes away right away. So I said, I think.
Well, now, John, you have a birthday coming up.
Yes.
Right?
Yes.
This week.
Yes.
I'm not going to say how old you are,
Okay.
but you and I are contemporaries.
Yes, that's right.
Right? And
well,
it's
you got a couple days on me.
Oh, right? Honey, I got a couple years on you. But nonetheless, the bottom line is this. Do we then sit you down and have you eat a crate of oranges? No. What we're doing is we actually deliver the vitamin C that you're talking about, and the extract in particular for you, because I have to be aware of several challenges you have, not just the cold coming on or the fatigue. So what we do is we put together a hydration protocol for you that actually works.
And I should mention, it's been 12 years since I had my bout with cancer.
I know.
12 years.
I know. And I remember it like it was yesterday.
We're knocking on wood here.
And I remember it like it was yesterday because we sat in that emergency room for quite a while.
Yeah, that's right. Let's talk about you mentioned hydration and
Yes.
what you get, and
Yeah.
I've been going for 20 years, and some people have been going for 10. But do you come in weekly? Do you come in twice a week? Do you come in once a month? How do you?
It really
work that?
depends, right? If somebody's coming in an acute situation, they may come in every day, right? When, during COVID, we had a lot of that,
Yes,
right?
yes.
So, they may come in every day. But the bottom line is this. We can put a protocol together with the hydration and also sometimes with traditional medication, and it depends on what it is we're trying to correct for the patient, and that includes the input from my physicians because they're the ones who treat the actual condition. And then what we want to do is we want to improve their quality of life. So it can be once a week, twice a week, or it can be once a month. It really depends on where you are in your continuum of health. That's the bottom line.
And there are patients, and I've talked to them in your clinic, and they said, well, they started once a week, then they went to every other week because
Yes.
they were doing well.
Right. Right. And you could have a little setback. It depends. Listen, when you have a diagnosis of cancer and you need some cancer support, you're probably going to come in once a week. And,
Right.
And that's a fact. In the beginning, you may have to come in 3 times a week. It depends. It depends on how quickly we can get your reserve where it needs to be.
You've treated, and you have over 600 protocols that you've developed
Sure.
for a variety of conditions. But what has worked best in your clinic? What conditions have you helped the most?
You know
I
what,
would say?
John? I'd like to say, that if anybody bought any of my 2 books that are out, and actually we're doing a compilation of the books, you know that I've treated people in their 20s, in their late teens, all the way up to 102. So the question becomes, what really is the most important thing for my patient? It's individualized. It's not what I see is a myriad of things. Of course, cancer is a big one.
Heart.
Autoimmune is a big one. Heart is a big one. But really, in the end, I only think of individuals because that's what's important to me. Your individual process, your individual progress. And so it depends. Right now, I would say I have a number of people have autoimmune. It seems like it's raised its ugly head. A number of post-Lyme people. I don't know why. You would think being in from COVID, you wouldn't have any problems. But you know what? It's mostly post-Lyme from being outside, being bitten before, treated traditionally, and now you have all the effects of the post-Lyme problems.
And you have post-COVID. You have
Oh
those
my
cases,
gosh,
right?
yes. We'll talk about that a little later, of course. That hasn't left us, believe me. It's just widened down a little bit. But if you've had COVID, you have some of the problems that are related to having had it. So, yes, I see that as well. And, of course, cancer again.
Talk about, and I know this has happened to you many times in an initial consultation, people come into you and they say, yeah, but Dr. Molly, I go to the health food store and I take this, I take that, I take this, and they give you the list, they give you the bag, and there's 20 things in there, of which 10 are no good.
Well,
but that's another story.
That's another whole story.
Right.
I mean,
So,
listen.
But talk about that aspect,
sure.
health food store versus what you do.
Well, my goodness, you can go into a health food store and luck out and get a very knowledgeable person there who can really help you rather than just point you in the direction of the aisle of the particular challenge you're looking at. But, the bottom line is you need to have advice, and that's something we give out and know well. We can help you get your oral products, but again, picking your oral products out from our perspective is a very individualized kind of process. And that's why coming to a place like ours will help you do that in addition to the IV hydration.
And your nurse Barbara is
she's
excellent
the best.
at
And
that
actually,
kind of thing.
we're educating Lana in that. Barbara's doing a great job. And, our people there are really very in tune with what patients need. We want to make people happy and healthy.
All right, we're coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday, 8 till 9, our live version here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, who is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly? You have a medical challenge you want to run by her? Perhaps she can give you some information to help you out with that. 855-839-1210 is our number here in the studio. 855-839-1210. We're coming back with more of today's edition of Health Watch after these words. Operators standing by right now at Innovative Medical Associates, as they are each and every week when we're here on the radio. 856-489-0505. That's the number. 856-489-0505. You can call right now, or you can call when we leave you at 9 o'clock, because they'll be there. In fact, they'll be there all day. 856-489-0505. And, of course, that's the number during the week as well, if you want to contact them. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website, and you'll find Dr. Molly's skincare products on the website as well, which, of course, I purchased a couple the other day.
Well, and I've been using them,
I've been using them. And
Thank
got
you,
a great facial from Ellie,
yeah,
which
she's
was
a great gal.
which was terrific, and just feel great.
Good.
So I just want to let you know.
Thank
you.
you.
Now I see your picture every morning with your skincare products.
You know what?
Okay?
One of my wonderful patients who's been with me a long time said, every morning I shower with you, Dr. Molly. I said, get out. So anyway.
All right, 855-839-1210 is our number here in the studio, 855-839-1210. If you have a question for Dr. Molly, or if you want to run by you have a medical challenge you want to run by her, certainly you can do that. You're very big on testing. We've often talked about testing. And this is another test?
Yeah.
A genetic test?
Yes.
That you did for a patient?
Yeah. Here's the thing. There are many types of genetic testing for many types of things. Everybody's familiar with the kind that you do if you're pregnant and you want to rule out genetics that might affect the newborn baby. There are genetic testing for cancer survivors. There's all kinds of genetic testing. In this case, I'm talking about a pharmacology genetic or genomic test. And the reason why I did this, it's intended to actually provide insight to the provider about genetic variations that might affect the outcomes of certain medications. So in this case, I have a patient who suffered from depression, and he has every reason to. Depression, anxiety, and a myriad of, I would say, rheumatic type of challenges. So I've been researching these pharmacokinetic drug testings, and I thought this is the one that he really needs to do. So we did the test on him a few weeks ago, and the results came back, and about a week ago we sat down and we had a conversation with the doctors and with the folks at the testing site about what types of antidepressant and anti-anxiety and other medications he ought to be on. It was quite insightful, because what it does, if you think about genetic testing, you're looking at a variation of the genes that affect how you metabolize those particular category of medication.
So the point of the test was to see how effective the drug was, or was it to change the drug?
It could have done both, to see how effective the drugs he were on, depending on how he metabolized those drugs, and see if they were an appropriate category of antidepressants, as well as anti-anxieties, and even as well as the sleeping medications. It also can do some work on the ADD and the ADHD component for a patient. So this is an all-encompassing test, and it came in, it was about, I think, about 18, 20 pages. So we sat down and we had a group conference with the testing docs. So it was quite insightful. And what is more important is how we operate, meaning how Hydration Clinics, Innovative Medicine, and Associates, how do we act? Well, here's what we did. We sat down with the patient. We saw through the genetic testing that his phenotype for himself was good. The particular drug that the psychiatrist, who he goes to, an outside psychiatrist, put him on is very effective. The only changes that had to be made was how the dosing was done for these particular drugs he was on. And I think that we then got permission from the patient to send it to his psychiatrist, and we sent all the paperwork over. And I think what's going to ultimately happen by this collaboration, that's the point, the collaboration, I think they're going to change the methodology in terms of how he's to take these medications and possibly move them to a more longer acting med, the particular category, but a longer acting dose. So my point is, because of the testing we looked at and how good the testing was, the psychiatrist knew all about the test and said, that's a good idea. Let's review it and see what changes are necessary. So this shows you the spirit of cooperation we have in our facility to work not just in the integrative realm, but truly in an integrative realm. We look at function, and we will then work with your other docs to see how we can implement this all together. And by the way, he's doing very well on the hydration therapies we're using right now.
How did you know to do this? Did you suspect from knowing the patient, because
Yes.
he's been a patient?
Yes.
You suspected something was not quite right?
Right. I suspect that he's such a compliant patient, and he's going through a lot of challenges in his life and successfully put some of those things behind him. I knew he would try to be compliant. It was a question of tweaking possibly what we were doing in the conventional world, as well as tweaking now. It gives me an insight on some of the things I need to put into his hydration to help maximize the ability of the pharmacology to do its job.
So you kind of suspected that there needed to be something done,
Right.
and the test confirmed what you thought.
And here's the thing. I didn't know what it was. Please beware. And my docs were looking at this and said, wow, this is really complex. You have to understand this. We're not psychiatrists, right?
Right.
So when we look at something, what we're looking at is how can we help the patient functionally while they're going to their psychiatrist for these types of medications. And I think that this test actually proved that it can be done.
This also says that you have often talked about working with your specialist, whether it be an oncologist or a psychiatrist,
Right.
or that you do work with them.
We try. We try. Sometimes they don't try to work with us, but I will tell you, when they get information like this test showed, there's no doubt that they can help us and we can help them. And that's the thing. I don't want to say, if somebody has a metabolic issue where they're poor metabolizer of a certain type of drug, whether that be a cancer drug or a neuro drug, isn't that good information?
Yes.
Or if they're a rapid metabolizer of a particular drug. These are the kinds of things I look at as a scientist. And I want to be on the team. That's all. I want to be on the healthcare team.
Now, you suspected this particular situation with this one patient.
Yeah.
But I'm assuming that you do this with other patients. So
I sure do.
When do you suggest they test or they do this kind of genetic testing?
It depends on what it is that we're trying to accomplish. Listen, sometimes these tests are not covered. I don't spend people's money indiscriminately. That's a plus here. We look at what we can do for a patient in terms of the underlying testing and those kinds of things that can be done through their insurance. But sometimes in other cases, we really get proactive. We might need to really test above and beyond the allergy tests that are out there traditionally. We may have to look at a genetic test for, let's say, food sensitivities, those kinds of things. That may have to cost the patient a few dollars. But the bottom line is, if there's a number of genetic tests out there that are decent, and believe me, I do the research on that, I want to use those for a patient if the need is there. The other area that I'm very hip on is that we know that when people have a cancer diagnosis and they've had a biopsy and the institution is sent out to a place for confirming data. The bottom line is we then like to get the slides, send them to a place that we know, and see what kind of other drugs that might be available or what trials might be out there for them. Not just nutritionally, but actually conventionally, John.
And I know you talked to me a few weeks ago about the liquid biopsy, and you
oh my
suggest
goodness,
I get
that was
it,
and actually technically that was really a different form. That was looking at cellular communication. There is so much out there right now from a scientific point of view and from a scientist point of view. I'm very excited about 21st century medicine, and we'll go into that a little bit on the next break.
Absolutely, it's just fascinating because I know you love this testing. And there's always, seems like you always come up with a new one.
It's not just the testing, John. It's the outcome. What can we do to improve a patient's quality of life based on data? I know that, listen, people will tell you that some of these genetic tests are junk tests. They are right. They're right. I'm very particular about the type that we do. You will hear me say over and over again, I love traditional laboratory. I came out of it.
Absolutely.
Came out of
yes.
it. So I love it. I know that it can do, but I also know there's cutting edge science out there, and it's not junk science.
We are coming up on the halfway point of the show, which means you still have plenty of time to call in if you have a question for Dr. Molly or a medical challenge. 855-839-1210 is our number here. 855-839-1210. Our show is Health Watch, Sundays 8 till 9, the live version here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm John DeMasi. We both return. More of today's Health Watch after these words. Welcome back to Health Watch. Operator standing by at Innovative Medical Associates right now at 856-489-0505, 856-489-0505. And you're asking the question probably, well, why would I call that number now? Well, very simple. If you would like to get more information and you want to make an appointment to sit down with Dr. Molly, the initial consultation is complimentary, and all you do is call that number, 856-489-0505, and schedule the appointment. Dr. Molly meets with a lot of folks who especially listen to the radio program during the week, and she'll be happy to meet with you as well. 856-489-0505 is the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. And our show is Health Watch, and you'll find us here, the live version, Sundays 8 till 9 on Talk Radio 1210, WPHT. Our number here in the studio, if you have a question right now for Dr. Molly or a particular medical challenge, 855-839-1210. We always tell you at this point of the show, you can call right now because we have plenty of time to talk to you, as opposed to sometimes people call when we have 2 minutes left of the show. Not a whole lot of time to talk to you about anything. 855-839-1210 is the number here in the studio. They call this regenerative medicine,
right.
Dr. Molly?
Regenerative medicine. Johnny, you know, last week, I think, or the week before, I started talking about this in general terms. And I was saying that we use the extracts of natural cells that we get generally through live births through the cords. Well, I really want to get more specific today. I want to talk about this in a way it's called progenitor cell therapy. So what that means is we're using a mixture that is from the donor, and in the end, what we're doing is we're delivering something called MSCs. MSCs are medicinal signaling cells, MSCs. And I want to tell you that they're being used all over the world. Right now, they're being used all over the world. And they're being used in this country. I've got to tell you, they have a lot of uses because what happens is you can use these in multiple dosing to help regenerate the body in terms of things like arthritic conditions. So you can inject them in the joints. You can use them through hydration, which we do. We've used them for muscle strength. We've used them in a sports injury for a patient. So there are many, many ways to do this. Now, I've also used them for peripheral neuropathy in this past 2 weeks. Very interesting case. I'm interested to hear how the patient does. We've used them to actually help our medical director. One of our medical directors who actually said to me this week when she came in, she feels fantastic.
And she looks a lot better than she did.
That's a very interesting thing. Now, you know, she was an anesthesiologist, and her fatigue level and what was going, she has MS, she'll tell you herself. She knew she couldn't do that type of work anymore, and she was lucky enough to come in as a patient, and we've been utilizing her talents, her medical talents, since then. So there's a lot to be said for using these MSC cells. What I find interesting is I've used it on a post-COVID patient, John. He's doing tremendously better. You know, he was in the hospital. This is Tim. He was in the hospital, And at that point, he was on 60 liters, I believe, of oxygen in the hospital. He was reduced when he came out to 4 or 5 liters. He's now down to about 2 liters on exercise, and we're helping him. Our physical therapist is working with him, and we're helping him. But he has said to me that he's feeling so wonderful. And of course, I get the same old story from the naysayers in the medical profession who tell me, oh, no, there's no data about that. Well, guess what, John? I have in front of me from clinicaltrials.gov, anybody out there can look this up, the efficacy of intravenous infusion of stem cells in the treatment of COVID-19 patients. Now, again, I didn't use this in the treatment of patients. I'm using it for the functional problems patients have when they have the post-COVID long hauler syndrome, okay? But what's interesting was this trial was recruiting in June 2020. Okay?
How about that?
Okay. All right. It was updated also in June of 2020. Don't know why. But it was interesting. There were no results posted. Don't know why that is either, but I want to tell you about my one patient who's post-COVID, and I'm hoping to do more. There are several patients lined up to do this, is doing so well. And I did something else. I found a white paper that actually was done by one of the team members on that survey on that clinical trial, who showed that stem cells actually worked in this patient, and it really helped. It helped the effectiveness in inhibiting the COVID-19. So it's all on the web. This tells you right there. It says stem cells, the efficacy in stem cells. So when I talk about progenitor cells, that's what I'm talking about. And how we use them at our facility is, remember, when you deliver these things through the hydration bag, the first pass is through the lungs. It's very important that the use of these and the types that you do, you can be sure I did the research. I mean, I know where to collect them, where to do it, and I know how many cells are in these particular mixtures, along with the growth factors, which are very important, and some other signaling cells that help these things actually do the work. And you can't use these in a vacuum, John. When I looked at this, I said it's one thing to put the seeds in the ground, but you usually have to tend to the crop. And that really is the difference in how we deliver these MSCs. And I think it's worth people looking into. And I know, just based on the small population that I'm using, by the way, I used them on myself.
Okay.
Okay, and there's not much that goes out of that clinic that I haven't done on myself. You could be sure of that.
Talk about what particular situations you would recommend this for. Is it knees? Is it joints?
Well,
is it?
I like all that.
Okay.
Because, we do PRP,
Right.
and we know that the wonderful doctor I have there can do these shots nicely and easily. Knees, shoulders, that kind of thing. Hips, a little more difficult because we'd really want that done in a surgical center, and I would direct you where to go. And also, I would say we use it a lot for the autoimmune disorders that really affect people's joints, et cetera, and we use that through the hydration.
So if someone thinks maybe they could use this or it might help them, just simply call you and
make an appointment, and we'll talk about it. Now, of course, we'd want to screen those patients. I mean, I want to make sure that everything else is working well. I want to make sure that your liver's functioning at a good rate, your kidneys are functioning at a good rate. We just don't throw these progenitor cells in a bag and give them to you. That's like, you might as well go to the voodoo doc. That's not going to happen in our place. We need to look at this. But what I do like about this, in particular, again, I like the fact that I'm seeing people who've had chronic condition like the MS doing better. I'm seeing someone like Sandy who said, well, I'm feeling okay. Okay is a big deal for her because you see how she hobbles in.
Yes.
Okay.
Well, I know
and,
that. Right.
And she's really up to another shot of these particular cells, and I'm going to get it for her. And I think it's going to make a difference. And I like this way of delivery through the hydration because it allows me to look at multiple dosing. That's why I like these MSC cells, because it fits into our philosophy that one dose size isn't for everybody.
Right. So this is done with the hydration.
Yes.
As is everything else.
As most things.
Okay. As
Or
most
injectable.
things.
Or
Right.
injectable in an area. Go ahead.
So, and it's done again once, twice. How does it?
It depends. The actual delivery is once, but what I need to do is I need to prepare your body for it. So you will have some growth factors, some cytokines. You may get a 1 hydration bag ahead or 2 hydration bags ahead. It depends on where you are in your continuum. We deliver that, and then I'm also going to deliver some growth factors, some interleukins that actually tone down inflammation, and I want these cells to go to work.
All right, we are coming up on our final break of the morning, which means you still have time to jump in here with a question or a comment for Dr. Molly. 855-839-1210 is the number here, 855-839-1210. Again, our show is Health Watch every Sunday, the live version, 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly, I'm your host, John DeMasi. We return more of today's Health Watch after these words. And we're back here on Health Watch. Operator standing by right now at Innovative Medical Associates. And as you probably know by now, if you've listened with any sort of regularity, that they're there after we leave you at 9 o'clock. In fact, they're there all day. 856-489-0505 is the number. 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. You want to call and make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and that's really where you can get a lot of good information and kind of help you out as far as your particular situation is concerned. 856-489-0505, and check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show this morning, well, we have our sleeper special. We have our Health Watch replay this afternoon from 4 till 5 here on Talk Radio 1210 WPHT. Some people say to us, Dr. Molly, well, I overslept this week. Well, tune in at 4 o'clock, okay?
Yeah, I do.
All right. 855-839-1210 is the number here. We still have some time left if you want to call in with a question or a thought for Dr. Molly. 855-839-1210. You want to continue this discussion of the cells and progenitor cells?
Yeah, but John, again, I'm going to tell people, all of these things that are out there telling you, and even the use of MSC cells, you got to realize you can't expect them to be like holy water. Just like I tell everybody, you need to have some synergies. We need to make sure that the body is in some type of shape to accept these. You got to realize God's given these cells. This is why I love God's ingredients. God's given these cells an innate ability to hone in on areas that are the worst areas, at least from a metabolic standpoint. So, for example, you may come in with what you think your joint pain is the most problem that you're having functionally in your mind. However, you may find out that these cells helped improve your cardiac output. So really, it's the cells have a honing device that are innate, given by God, that can go to the place that's needed the most. So, we can work the protocol so that we address things like the joint pain, etc., and maybe the muscle fatigue and all of that. But I expect that these cells will hone in an orderly manner as to what is needed to actually improve your overall quality of life.
Talk about the patient that you were telling me before the show that the lung capacity improved.
That's Tim, and he's actually doing better. He's now down to 2. He's on 2 on his at-home oxygen, and we're working with him right now, and we're using something that is sort of like a power plate, because what we're trying to do is get the muscles to regenerate, to restart working in a way that's orderly. And he's doing really, really well because he came back from COVID and he said, I'm feeling good. I put him on a post-COVID protocol. I hadn't done the MSC cells yet because he wasn't ready for them. When he was, I delivered, and he goes, Dr. Molly, I'm feeling like a new person. I said, I get that. He goes, well, I'm going to go home and work out. I said, no, you're not. No, you're not. And I said, come on, I'm going to show you why. So we put him on the power plate, and we showed him with a pulse ox that without his oxygen right on, he was going down to like 90. We stopped the power plate, which is like a vibrating plate. People know about this. It's everywhere. QVC, it's whatever.
Yes, exactly.
Right?
Yeah.
Come on. But we have an actual medical one. And we showed him that without his oxygen on, he went way down. So I said, you're not ready yet to go to your home gym. You're just not ready.
Right.
So please bear up. And this is true for all the long haulers. I mean, I have a whole post-COVID protocol that includes vitamin C, that includes alpha lipoic acid, and it includes progenitor cells as we go on. This protocol may have to go on for 3 or 4 months. And by the way, that's pretty quick compared to what people are talking about in terms of long hauling, right?
I wanted to ask you, you hear all this stuff about knee replacements and hip replacements and all of that.
Yeah.
Is this the way to go first before you do that, or where does this fit in?
Well, as far as I'm concerned, it fits in, of course, first. Obviously, if you have bone on bone and you can't live with it anymore, you got to get replacement. But I told you last week, I had 2 cases of metal poisoning or metal problems, not to say poisoning, but definitely metals, high levels of cobalt and high levels of mercury in 2 other patients who've had these replacements. And I actually was talking to one of my docs this week. She had a hip replacement. The same doc we gave the MSCs to had a hip replacement. And she said, I've been thinking a lot about this since you talked about it. She said, and I got this, and it says I have a plastic replacement, I guess, ball joint. I said, well, that's good. She said, yeah, it's good if the plastic doesn't rumble.
Right.
I said, that's true. She said, so I better get in my chair again. I said, yeah. Don't worry, Pat, you're there. So, but the point is, we need to look at all of this, John. Our bodies are something beautiful, but we have the responsibility to take care of them.
Let's talk about, you talked about this, the ball replacing and all of this stuff.
Sure.
I mean, if you have, let's say, arthritis, is this
sure.
an area?
Any of these, arthritis, joint pain. One of the things that I'm looking at more and more, COPD, obviously, because of the success I'm having with the COVID patient, right? Post-pneumonia. I think these are the kind of things. I'm also looking at this, and I have to do more research, I admit, in terms of diabetic outcome, because I'm thinking to myself, wouldn't it be wonderful if it helps in some way optimize the pancreas? I think it can. I've been doing a ton of research. I have a book that is so huge, John. It's like the size of the Encyclopedia Britannica in the old days.
Yeah, I remember.
Right? You saw me carry this thing out.
Yes.
And I'm looking at that in terms of what else can this thing help to improve in terms of functionality for a patient. And again, I'm not looking for cures. I'm looking for your functional life. How is your quality of life, regardless of what challenge you have?
In general, just pain, would this help?
I
if you just have pain somewhere?
I think so. And I think, again, it's going to be subjective, but I think along with some of the other things I would use in the protocol, because I am a firm believer that everything works synergistically. There is not one thing that's the magic bullet. Anything that we deliver hydration-wise, it's not holy water. It takes a process. And I think that that's the most important thing that anyone can walk away with. There is a process. And that's why, John, I don't like to take patients who come in and want one and done, because it doesn't work that way. And every time I do it, I beat myself up afterwards because it doesn't work for them, and it certainly doesn't work for me.
And you and I have talked about advertising for years, and I said to you, one commercial doesn't work.
That's right.
Same thing here, right?
Right. You got to come in.
Right.
You got to come in. We got to have a program, and we've got to get consistent about it. But I'll tell you, if you do it, you're going to end up in a better place than when you started with me, and you're also going to end up feeling and doing more. And that we're about quality, John. Quality's our number.
A good point to wrap up the show with. As always, thank you, Dr. Molly.
Thank you.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at 856-489-0505, 856-489-0505, and the website innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, missed any of today's show or you want to hear it again, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Joanne, fabulous Fran, delightful Dee, and our nurses Lana and Jess, and our medical assistant Karen Kathy, I'm your host John DeMasi. Always a pleasure. Thanks for listening. Have yourself a great week and a healthy one. We'll talk to you again live next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.